Hello, everyone. I hope you are all well. My name is Emily Spranger. I'm an academic trainer for the Center for Teaching and Learning, and we're happy to have you join us today. We have Dr. Carissa Smock from the School of Business, and she'll be presenting some work today for health services during the pandemic. Just a couple of housekeeping items. Dr. Smock has mentioned that we can ask questions in the Q&A. So if you are not familiar with where the Q&A is, if you hover your mouse towards the bottom of your Zoom screen, you should see a Q&A box pop up. You can open that and ask questions in there. The chat function is open, but the preference would be to ask questions in the Q&A. So, and she will address questions as she goes through her presentation. And of course, we can always field questions at the end of the presentation as well. So don't hesitate to use that function. And without further ado, I will turn this over to Dr. Smock. Thank you so much.
Thank you so much, Emily, and thank you to each of you for sharing part of your day with me. As Emily mentioned, I'm over in the School of Business, focusing and working with students on health services dissertations. I also teach some leadership courses and do some research myself in health services. And as we will talk through today, I really focus on connecting clinical care to physical activity and nature. And we're really going to dive into how there's this heightened importance of this during COVID to really be able to focus on something that we all can do. You know, there's so much right now that we don't know. We're all anxiously awaiting a vaccine. We're all learning day by day as things go on, new best practices and ways to manage the pandemic. But at the same time, we can all focus on prevention efforts to really try and keep ourselves healthy, keep our families and friends healthy, keep ourselves out of the clinical care as much as we can, and really protect our immunity as best as we can. All right. So fortunately, this work is part of a faculty research capacity award at NCU. The official start of it is actually just this week. So what a way to get things started than to present with all of you today. And I'd love to hear your insights on what might be helpful in your perspectives as well. So like I said, I really want to dive into some of the business case, the importance, and just how much we really can do by being physically active and really trying to promote it. So there's a lot of research that has been done that shows that spending time in nature and physical activity are more vital during the pandemic to reduce stress, reduce sick days, increase productivity, increase morale, increase immune systems, and then reduce healthcare spend and healthcare utilization. So this equation here just really talks.
Dr. Smock, I'm so sorry to interrupt you, but can you make sure you share your screen with us?
Oh, I'm sorry. It looked like it was. I greatly appreciate that.
So sorry about that.
We go back in. For whatever reason, on my end, it looked like it was sharing.
That's okay. We can take a moment or two. No problem.
Thank you.
In the age of Zoom, this happens.
Oh, goodness. Okay. There we go.
Thank you so much.
Sure. And
We're good.
Anytime anything's awry, you just let me know.
Okay, absolutely.
All right, well, here is the picture that I would like to jump into, and can really, if we all get outside. This is a picture in Ohio where I live, and a beautiful trail that I really love to go on to really try and work on being active and promote being active. And there's my disclosure, and here's the slide I was talking about. So here's the equation. So again, there's a lot of things that we can try to reduce that can result in some positive increases and then some helpful reduction in healthcare spend and healthcare use. Because as we all know, right now, I know in Ohio, our hospitals are at capacity. So if we can do what we can to prevent ourselves from even getting COVID, in addition to masking and all of those other safety precautions, by increasing our immune response. So here, I wanted to put a slide together. Fair Health put together some cost projections of how much COVID costs. And I don't think I have to tell anyone that it costs a lot. So over on the right here, you can see a graph, and it's broken down by if someone is not insured or out of network. In the lighter blue, the dark blue, private insurance. And then in the orange there, we have Medicare, and in that lighter green, Medicaid. But even in that lowest cost, so what we're looking at here, professional care means seeing a physician or a clinician because of COVID. Then there's the 6-day inpatient stay, then the total costs. And if we add all of this up together and we look at the US population, the American health insurance plans says that it's going to be about $550 billion that we might spend on COVID-19. So that's a lot of our resources. At the same time, we know that physical inactivity, so not being active, following the US recommendations that are about 30 minutes of being active a day, most days of the week. This can be walking, this can be gardening, cycling, anything where you are moving. Actually costs a lot of money before COVID. So a lot of the most recent reports out there are from 2018. And in the US, I have some data on the left here that says that there's over 8% of deaths are being attributed to folks not being active. And this is information that has been put together by the CDC, the Centers for Disease Control, and then the total healthcare expenditures, this is pre-COVID, were greater than about 11% just because of physical inactivity. And this equates to about $117 billion a year. And then over to the right, I put together some information from the World Health Organization. And of course, the US always tends to be at the very top when it comes to healthcare spend. And so this is the burden that, compared to other countries, of physical inactivity in the US. You can see that purplish blue graph there shows just how much more that burden is in the US than anywhere else. So it's a lot of money that we can save, both by trying to stay as well as we can and just being physically active. And I wanted to show a little bit about why this is and where all this savings comes from. So this is a graphic that was put together by an international physical activity group. And their data shows that about 30% of all mortality could be avoided if folks were active. And as you go around that circle there, you can see 68% of hip fractures, 30% of depression, colon cancer, breast cancer, dementia, diabetes, heart disease. All of these very costly diseases could be avoided by a large percent by being physically active. And it is very good for business to be physically active. So I don't know if I'm going to show how old I am, but if anybody out there remembers that commercial, this is your brain on drugs commercial, perhaps. There was an egg on a sidewalk involved. Well, if you do, I am now showing you, this is your brain on physical activity, and this is your brain without physical activity. So this was a study that was done out of the University of Illinois back in 2014. And on the right side, you can see sort of a heat map of brain activity. And you can see that brain on the right looks far more active and like there's a lot more going on after about a 20-minute walk. And then on the left, that's after sitting quietly. So you can see how this physical activity really does increase brain activity. So in addition to preventing all of these diseases and healthcare use and even death, physical activity can save businesses quite a lot of money by making people more productive. So on the right, there's a graphic, and some studies have been done that show that physical activity increases productivity by about 15%. And if you think about your work week, that's about a whole day. 15% might not really seem like that much, but it's the greater part of a day. One day is 20% of your week. So that's a quite substantial increase. There's a 27% decrease in being absent, sick days, things like that. And on average, there's 2.5 less hours a week of sick time in those who are physically active. And so we bring all of this together to think through some of these recommendations that have been made to stay active during COVID-19. So like I've mentioned, being physically active is a protective factor that strengthens the immune system to be able to better fight off COVID-19, as well as all of those other chronic conditions, just about everything. It really is, we were talking before this, kind of like this magic pill. But of course, it's not that simple, I think, as we all know. And if it is done outside, physical activity is done outside, there's increased benefits by being in an environment that can be relaxing, such as in a park, and also because of the absorption of vitamin D. And then just being able to fight off all of those other diseases. We've all heard, there's people that are more vulnerable to COVID-19 because they have other conditions that lower their immune response already. But we know it is not that simple. Not everyone has access to safe physical activity, to safe locations in nature. And there are a whole host of barriers. And this is why, on a couple slides past, we know that only about 25% or so of people report physical activity. There's other studies that suggest it might be about as low as 10% of folks that actually reach the physical activity recommendations of about 30 minutes a day, most days of the week. A lot of times it is difficult for all of us to have the time or the resources And especially during COVID, there's even more challenges to think beyond basic needs, the needs for a job, for food, for healthcare. People may not have a safe way to get to spaces for physical activity. Perhaps their neighborhood doesn't have sidewalks or safe streets without a whole lot of traffic, or perhaps they don't have a yard, a park that they could get to. Sometimes in a neighborhood or in a park, there might be too much crime. There could be pollution or other environmental hazards. This could be anything from, weather conditions, intense heat that tend to be in lower economic parks and neighborhoods. And many times there are people that feel like they don't belong in these spaces. And because they feel like they don't belong, they feel like they have to take these extra precautions and make sure that they are not wearing hoodies or baggy pants so that people are not concerned about what they are doing. So there's just a whole number of barriers that make it difficult for people to get this physical activity, or else it would probably be a lot higher than that 25 to 10% of people. So in addition to all of this, to make things more complicated, there's been a whole host of recommendations that have been changing, and that's because we've never been in this situation before. So public health folks, park folks are trying to understand the best recommendations with the best information they have available to make recommendations about how to be active during the pandemic. So one of the ways I've been involved with this is through the American Public Health Association. I chair the physical activity section. There's about 700 of us. And so we put together a COVID-19 task force, and we put together, again, are keeping up on the latest research and publications in this area. We're getting ready to put together a review in 2021 of the literature that's out there, some of that early literature. We've been keeping an eye on organizations with best practices as they evolve during the pandemic, looking at both also the gray literature, the non-peer-reviewed publications, perhaps blogs, white papers, that many of the researchers and some of the very most experienced physical activity researchers have been putting out there. The same folks that put together the first physical activity guidelines back in the 90s have been publishing information on COVID-19. And we're trying to really make suggestions about how to have safe physical activity the best that we can by providing some written, live, and recorded workouts for folks to do wherever they might be able to be active. And then we've been trying to encourage folks working in this area with some awards to really recognize this important work. And here's a list of some of that research that we know is going on out there because of what's going on in our section. So everything from behaviors of parents and young kids during the pandemic to looking at how physical activity has changed, indoor, outdoor, online activities, and information about what's been going on during stay-at-home orders within very specific states and regions, and then studies on mental, physical, and emotional health. And here are some of those resources that have been some of those go-tos that came together with very early recommendations and have really been staying up to date. The World Health Organization, the American Heart Association, the American College on Sports Medicine, the American Institute cancer research. And this brings me to some of the research that I am working with one of our alumni, Dr. Lisa Schinder. She graduated from NCU about a year ago, and we've continued our work together through this. And so we're looking at changes in nature-based physical activity and stress levels before and during the pandemic. Originally, when we put this together and started working on this in March, we feel a little silly in thinking it used to be levels before, during, and after. We thought we were going to magically have this after to report on in 2020. So instead, it's before, during, and hopefully someday we will get to an after. But we know recommendations have changed, restrictions have changed. And so that's why it's really important to continue to collect some data so that we can look at the different mandates that were in place and the different studies and science we had out there, so that we could look at how behaviors changed as we understood more, and to also understand those socioeconomic shifts as well. So here, these socioeconomic shifts can really be guided by the theory, and we use this when we're looking at health quite a bit and we're looking at health behaviors. So this, we're looking at all of these different levels. So the very interior level, as some of you might be familiar with, are those personal levels. Maybe somebody already has chronic conditions that make it difficult to exercise. Maybe they have preferences in their physical activity and they have trouble, say they prefer to do it at a gym and that gym is closed right now. And then that next layer is family. This could be, children or elderly or other folks that they might be responsible for and that they don't have as much childcare for. And then going out to each one of these levels, you can see some of these descriptions. Interpersonal, so this is going out a little bit further, maybe coworkers, different norms within your work environment and work culture that either really help support physical activity or make it a little bit more difficult. Those community layers, having safe sidewalks or streets or not. And then that policy. So these policies are going to be things like our stay-at-home orders or parks shutting down, things like that.
And actually, Dr. Smock, this is perfect timing because it relates exactly to this question in the Q&A. Would you mind if I ask it for you?
Oh, sure.
Okay, great.
Absolutely.
So one of the questions in the Q&A, do you have this broken down by demographics, socioeconomic levels, for instance, or by race or ethnicity is the question?
Physical inactivity broken down by that?
Oh, hold on. That's a good question.
Sure.
Hold on. Let's see. Kate, would you mind just real quick see if that is in relation to physical inactivity? Yes.
Yes. Well, I can tell you that there is a lot of literature that shows that that minorities have a lot more physical inactivity, and those with socioeconomic status, there's an inverse relationship there, unfortunately, with the lower the socioeconomic status, the higher the physical inactivity, unfortunately. And that's why this is such a complex problem, because, implementing policies or trying to make changes in communities that have a lot of resources is a lot easier than those that do not. And it's already a challenging problem. It's already such a high percent of the population of folks who are physically inactive, that, you know, a lot of times interventions have been done in those neighborhoods that have more resources, because it's so challenging to do it in those that have less, and that's a huge problem. And I actually collaborated with a couple of our other faculty members. I will go ahead and just call them out. Dr. Robin Butler and Dr. Marie Bakari and I submitted a grant application to try and work on this very problem, to try and work on these lower served communities and how there just are not spaces to be active, and how the research that's being done out there is just not reaching those people.
And there's actually just a couple of follow-up questions for Kate. If there's, can we have those addressed right now?
Sure.
So there's a couple of things in the Q&A. So what I'm going to do is she's asked a few questions. So I'm going to allow to talk just because I want to make sure we're able to address this.
Mm-hmm.
So.
Hi, can you hear me?
Yeah. Hi, Kate.
Sorry, hi. I'm thrilled when this came up. I was like, oh my goodness, that's my area of research and work. So I was just delighted. I mean, sort of, it's related. It's not identical. But I work with Hispanic and Latinx communities. And so that was what I was curious about, because I know that in the communities that I work with, of course, it's not that they're inactive, it's that they're working all the time. And so these are families typically, and even students, I'm talking about all the way down to 9th grade. So what I see all the time in a very large community, and I'm in Colorado, so what I see on the Front Range is that I have probably the students even that I know of would love to be able to participate in sports and go to the gym and do this, but typically they're working jobs, they're doing full-time school, and they're taking care of siblings while their family members and parents and aunts and uncles and whoever else is in the house are also working all the time. And so that's why I was really interested to see your demographic breakdown, because I'm wondering how much of it is a frame. If you're looking at it from the ecological model, how much of it is a frame from who even would fit within that frame if they're, I guess that's what I was, sorry, I'm rambling, but going back
No, it's so wonderful to learn from your expertise. And, you know, I did not put a graphic or a slide in here that shows that, but it is out there.
Right. I figured, yeah, there's a lot, but I hadn't seen, because my research is in access to care and what that looks like. So it isn't exactly through the physical activity, but one of my colleagues is a sports exercise and health person, and so working with the same community. So I know he's going to ask me, so did they talk about that breakdown? You know, I can kind of, sort of, it's a little different. But I know that's why I'm wondering how it is in the research that you're defining the construct of activity.
That was one of her questions. What is activity defined as? Mm-hmm.
Yeah, because I know a lot of these parents that I speak with, for instance, they're on their feet 12, 15 hours a day, or they're walking in a line, or they're carrying children back and forth from different. So I'm just wondering how would you even measure that? That's actually
right. That's an excellent question.
How would you measure it? Yeah.
Right. So, you know, this is just really, and I'll get to on this particular piece of research and how those other research studies that I included measured it, but it's really defining activity as any movement that adds up to about 30 minutes a day. So so those folks would be meeting the guidelines.
Right.
So a new set of guidelines came out. It used to be that physical activity was only really measured if it was done for at least 10 minutes at a time. And so those folks very, very likely were probably meeting it then too. And then a new set of guidelines just came out a couple years ago that said every minute counts. Every minute throughout your whole day, you know, add all of that up, and it definitely increases, you know, all of the benefits.
That's good to know. That means I'm okay. Woohoo!
There you go.
Well, thank you so much, Kate, for bringing that up. That was, it's interesting to think of it and how what you count as inactivity or activity. So thank you for asking. Okay.
Thank you so much.
Yes. Thank you, Kate. And I'd love to connect and learn about more what you and your colleagues are doing offline another time as well.
Oh, sure. That'd be great. I would love that. Thank you so much.
All right. Thank you.
Very, very helpful and important questions. And I'm so glad I wrote down some notes. It's always good to think through what else you could include to really help communicate what is known so far and what is not known, because there's a lot that we don't.
So Dr. Smock, there are several questions in the Q&A. Would you like to continue on in the presentation for a little bit and then circle back?
I'm fine with
addressing
those. Sure.
Okay, great. Do you believe, this is from Lorraine, do you believe a countrywide mandate would help to lower the number of COVID-19 incidents?
A mandate to be active?
That's a good question. So Lorraine, if you want to go ahead, you can just type that in real quick to see if it's I think she's maybe referring to a shutdown is what I think maybe she's referring to. But I'm not sure because it says a countrywide mandate would help to lower the number of COVID-19 incidents. I'm going to circle back to that one and see if she can clarify. And then Kate and Dr. Smock, Patrick asked this question. Could it be that within this group that it is not a cultural experience? And I think we kind of touched on that.
Absolutely, yes.
Okay, great. And then let me see one more. Oh, Lorraine does say a shutdown. So to follow up on her question.
Well, you know, that is a little bit, I guess, wasn't going to quite head in that direction. You know, there's just, that is a very challenging question, you know, that our whole country is dealing with to try and figure out, you know, what shutdowns, I mean, as it really pertains directly to this, a shutdown and access to physical activity, something that we learned that was really important is that we really do not need to shut our parks down, because, you know, playgrounds and parks were shut down in some states, in some localities for a little while. And then fortunately we learned more, and we learned that that really, you know, did not need to, it appear, and we're still learning things, but appears as though that does not really increase the spread. And it appears as though convening in the indoor spaces is what does increase the spread. So just like all the recommendations, trying to stay out of gathering in indoor spaces. And if we can do that on our own, then we don't need a shutdown for that to happen.
Thank you so much for answering that. We appreciate it. And I'm going to go ahead and let you move on so we can address some of the things at the end. But thank you for answering our questions.
Absolutely. So there's a lot of research out there, and physical activity is really a broad research area, as I think we're really diving into. And, you know, I'm involved in a few different groups, and within those groups, there's subgroups, and within those subgroups, there's more subgroups of focus within physical activity. So I did some work to dive into how people were moving around during the most strict stay-at-home orders in Ohio compared to before. And as I said, we're going to collect more data because unfortunately after is not quite here. So we knew from things like Google Analytics that more, and just observation and different parks keeping tallies, that more people were going to parks. Now, a lot of that information, we don't know if they're being active there or exactly what they're doing. But we didn't know if these people were folks that used to go to gyms that were now shut down, or if they're people new to getting out and being active, or a combination of both. So we conducted this study to try and figure out a little bit more and understand just a little bit more about what's going on. So we know that there's all this different messaging that was going out there about physical activity in parks when COVID first started, as we were learning more information. Just like anything else, if you are sick or were exposed, even though parks don't tend to spread as much, it is still advised that you do stay home and you don't go out anywhere. And advised not to travel long distance and to stay close to home, and to avoid busy parks as well, and just make plans about what to expect. I know there's been a lot of reopening of things, but during this most strict mandate, a lot of restrooms were shut down, certainly in the areas that we were studying. Other amenities like water fountains and playgrounds and different things were also closed. Recommendations were out there, and you can see some of these recommendations in this graphic to, again, stay close to home, stay in your neighborhood, stay home, maybe do an online workout or a recorded workout, or just do your own thing in your home. This graphic just talks about dancing and doing some laps. All activity counts. And then we also know that there are changes in the built environment. So those spaces that are man-made that might support physical activity. So we need to keep a 6-foot distance. As you can see in this photo, that's a large sidewalk. A lot of us, if we're fortunate enough to have sidewalks, might have something like a 3-foot sidewalk. So what do you do if you need to pass someone? You either have to jog into traffic or try to jog into a yard or a business or something, which can make things more challenging. Folks might use different, I know there's a monument near my house, and I like to go do the steps there and do laps there, and that shut down. So just to know what might be available or not. Helpful to physical activity in the built environment is that there was less traffic. So it was safer to walk or cycle or jog in the street. Bike shares were shut down. Some still are, some have opened back up. Like I said, some parking lots have shut down, maybe even at trailheads in different places. And then one way and one whole area of physical activity research is active transport, which includes walking or cycling to things like bus stops or trains to get from to work or school or wherever you might need to go. And it was encouraged not to use those. And here's some more information about ways to try and stay active during COVID at home, just brainstorming ideas to try and keep it interesting. And here's and recommendations about breaking up desk time with some breaks, or, maybe standing desks, or working from your countertop so you can stand while you work, or whatever you might have access to. And these are all really examples of the information that was going out there to better understand what information might be influencing people's behaviors as they make the decision to possibly shift what they were doing. And here's the recommendations, or one of the recommendations about parks here as well. I think we went through a lot of this information. So we partnered with a metro park and actually also a county park to recruit participants through an online research panel. And originally we asked folks to download an app that would share their data if they had something that already tracked their steps. So for instance, if someone had Apple Health, or if someone had a Fitbit, there are apps out there that can bring all of that data together and allow the researcher to see it if the participant gives you permission. That turned out to be a little bit complicated, so we made that optional. But we asked them to go ahead and go into their device, even if they didn't want to do the app, and just record the miles and steps that were in there if they had them. To also self-report physical activity, as well as the mode, the kind of physical activity, and the location that they were doing it in, both before the stay-at-home orders and during. And then we asked them questions about their changes in childcare and employment, and asked them to create a survey code so we could try and connect these answers, but not know who these folks were. So here's some of the instruments that we used that are validated. This International Physical Activity Questionnaire has been used for a couple of decades. It is validated. I just saw a study in at least over 13 different countries. And it is kind of the standard and what other folks that are doing this physical activity and COVID research are using. It's a 7-day recall of physical activity, and it asks you different kinds of questions to try and get to what that person might be doing. So as it was wonderfully asked before, people might not always think of some of their activities as physical activities because they are day-to-day things for them that they might do at work. So it will capture that. So that's an excellent question. We also wanted to capture some levels of stress and mood. And one validated way to do this is through an Eisenberg self-esteem scale, and then also through the positive and negative effect schedule mood questionnaire to see before the shutdown and during how there might be shifts. And we did our analysis in SPSS to look at some descriptive and inferential statistics. As I said before, we looked at Google Analytics to try and get some idea. And I will share that Google Analytics over the past several months, several of you probably know even more about it than I do, has come a long way. Google is on top of everything, always it seems. And so they have really increased their ability to, and the application of the data they collect to better understand how people are moving around and visiting different places during the pandemic. And we're currently working with our partners to look at their internal measures of park use as well. So in our preliminary results, we found that compared to before the shutdown and during the most strict time, which would have been like April and May in Ohio, there was over a 255 increase of park use. This is kind of a pilot test because we've never, collected data exactly like this with this combination of instruments before. So we're still learning from this, and the shorter your surveys and questionnaires, the more folks tend to answer and complete the entire survey. So we're still working through the best way to make changes as we move forward and collect more data. And like I said, one thing that we really found that was a barrier to participation was having folks link to something else. Everyone has so much going on right now that participating, answer any questions at all is extremely helpful, huge to help us understand how to support physical activity. And so we wanted to make it as easy as possible to participate. And on this slide, I have a code that you can scan to link to Google Analytics so you can see what's going on there if you haven't already. Or you can just open Google and put in there on analytics, and you'll see how much they've really increased their ability to, share what's going on, which can be scary to think about sometimes, but helpful for research.
Well, I wanted to jump in real quick because I think this might be tied to maybe the type of research that you've collected. And Timothy had asked, have you examined the perceptual barriers with regards to attitudes towards the threat of COVID? Have you looked at that in terms of the research that you're collecting?
We didn't have a question in there that asked directly, did you change because of COVID? But we just rather asked them to self-report what they did. But that's helpful. That could be a really good question to consider. I'm going to jot it down.
Perceptual barriers. Yeah. Okay, thank you.
Yes, thank you so much for that question. One thing that we a lot of times put into our physical activity are beliefs around the benefits. So we might put in questions about, on a scale of 1 to 5, do you believe that physical activity will increase your overall health? Do you believe it will help your mental health? Do you believe that exercising in nature is even more beneficial? To include a gauge of where people's belief systems already are around physical activity. So to look at physical activity during COVID, that would be helpful as well. To put some sort of, we could work on validating a scale to try and capture the threat of COVID. Do you believe that exercising in a park is dangerous? Do you believe that, physical activity increases your immune system response? And then we could work through the very intensive process that is validating a scale. And that would be an excellent project. All right. So here's a look at our participants. So as you can see, we had some good representation in male versus female, not good representation in, diversity. And this is, a panel at a park system. We already know that people that tend to use parks the most do tend to be white, that there's not a good representation there already. So this is, of course, disappointing, but not surprising due to the literature. And so there's a lot more work that needs to be done because we are missing so many folks by just doing our research within these panels. And so there's a lot of really important next steps. We did have some good representation between those in the workforce, those retired, switched to working from home, had to switch to homeschooling. We did find significance within our information. Unfortunately, but not surprisingly, mental health declines were significant in both of those mood scores. Men were significantly more likely to exercise at a park during the pandemic. Not surprisingly, declines were greater with work and childcare changes, and changes in the location where folks did their exercise was also significant. So, as I was getting to, there's a whole host of limitations here. We did not have a representation sample. It was also a pilot study. It was a group of folks who are park enthusiasts that volunteer to sit on a park panel. So we know there's going to be a whole host of bias there. So what that is helpful for is, as we're trying to do this preliminary work and trying to think through what is the best way to pilot this, how can we get the most response, ask the least amount of questions to get the most data, it's good to do it with these folks so that when we go to a sample that is more representative, where we do have representation, we know that we are, have the most concise and informative instrument and research designed to present to the folks who are working 2, 3, who knows how many jobs, and really don't have the time, don't have the bandwidth to even think about whether or not their job included them being active. There's also some bias that folks might be more motivated to exercise knowing that their activity will be tracked. So say as we're piloting, the same group of folks does answer another during survey, they might be more likely to continue their exercise thinking, well, I'm going to have to answer a question about this, so I want to make sure I'm staying active. But we are still getting more of a picture about what is going on despite all of these limitations. Not surprising, we have some implications around mental health and physical activity declining more when there's job and child care changes during the pandemic. We really need to figure out ways to capture the inequity. This research study did not capture that, and we do not pretend that it did. But again, it might have helped develop the design and develop the instrument that once we do get to a place where we can collect data from these populations that we need to reach the most, we have the highest quality information that will cost them the least amount of time. And so we're working through all of this. So next steps, there's a ton of them, but more data collection points, comparing more to these internal data sources that these parks have, going back into Google Analytics and looking at different time points, learning what else can data do or Google do, what else are they working on. There's an opportunity to even compare to social media posts about, the closures at the parks. I was just talking with a reporter that records, I want his job. He goes around and records trails on his bicycle and then posts it to the newspaper site to say, hey, look at this cool trail you should go do. So that sounds amazing. And so we might be able to work together to look at how that might increase trail use or increase familiarity with trails to go use them. And we're also working on a Safe Routes to School partnership, and that's a program that is national. There's safe routes to parks, safe routes to different locations out there, to think through during COVID how we can promote getting safely to a park or place for physical activity, or maybe even getting in physical activity as we're going through our day-to-day lives, like going to school. And so big picture, There's so many questions out there, as we were starting to get to. We need to reimagine how can we think about spaces where everybody feels safe, everybody feels comfortable. We're not even close to that, unfortunately, right now. There's a lot of work to be done. But how can we contribute to a small step in the right direction? Because that's how research works. How can we look at different places like land banks, which are those different, small pieces of property sometimes, or buildings that perhaps have been foreclosed, and maybe we can look at those spaces for physical activity. How can we address environmental problems? How can we include what the community really needs, or what challenges those people are really having, including their voice, and not trying to speak for them through some panel that doesn't represent them at all. So clearly, we have a ton of work to do. So everyone, of course, can work on this. If you're a student, this is such a broad category that can apply to any of our schools at NCU. Education, obviously any of the health related areas. You can be a part of different organizations and advocate, do research, and get involved there. And there's my contact and the alumna, Dr. Lisa Schinder, who worked really hard on this as well.
Great. I'm so glad you were able to put that contact information up there. If you don't mind leaving it up. We do have just a few minutes, so I'm going to try to get through some of the questions in the Q&A.
Sure.
I'm just going to go straight down the list.
Mm-hmm.
Samantha asked, do you feel other countries have been successful with the mandated shutdown?
I feel like this is above my level of expertise,
Okay.
but there's a lot of ways to measure it, and there's a lot of political polls around all of this. I will say, we can let the data speak for themselves, and we can look at rates, and we can look, of COVID and other comorbidities, and then we can compare them to policies and let those data speak for themselves.
Okay, absolutely. Patrick says, Dr. Smock, do you foresee guidelines coming out on home-based exercise? Winter's coming soon for many of us, and outside activities may be hindered.
Yes, so I think, there has been some work done. Some different gyms and things have worked, even YMCAs, to do virtual workouts. So I think, there was that direction that we started to move in the spring. And then we've gotten to the summer. And I think as we shift back, I think there'll be more promotion of winter, or even just how to do your best to be comfortable in colder weather.
Absolutely. Lorraine asked, how do you perceive physical activities in the home as opposed to physical activities outside during this time?
Yes. So in terms of safety, from the data that we've seen so far, as long as folks are feeling well and keep distance outside, it has not shown to be unsafe. So now inside, I can tell you that I have not gone to a gym. I don't think it's the safest option currently, but working out at home, of course, indoors would be, in terms of physical activity, the thing that you need to be very careful of is injury if you are alone. So making sure, that you progress slowly through exercise, and, because we don't want to slip or fall and not have anybody to know about it.
Absolutely. And then there are a few more questions. So I would like to, since we're at the top of the hour, if it's okay, Dr. Smock, if it's something that is really, that you would really like answered by Dr. Smock, would they be able to reach out to you via email?
Absolutely. I'll do my best.
I know, I do understand. I do
Yeah.
understand. One of the questions was, are you still collecting data? But I believe you are still collecting data.
Yes.
And do you have delimiters for who can participate?
So far, it's just 18 years or older.
Okay.
Right now, we haven't been doing any children, but we hope to cast a much broader net.
Okay, and then this is the very last one before we go. And then at the end of your study, comparing and contrasting the findings, right? You'll be doing some comparing and contrasting of your findings at the end of your study?
Yes, and honestly, we don't know when that's going to be yet. I would not recommend this work for a dissertation. I mean, you could with a lot of during points, but we want to keep working on this and understand what goes on after. We, of course, don't really expect everything to, there's probably always going to be some differences after going through all this. So we do want to see what's going on there.
Absolutely. Well, Dr. Smock, I want to thank you so much for your time that you have taken today to share with us your information. This is a very interesting time, and clearly your research is going to be being conducted for a little bit longer, as you had mentioned. And as a reminder, this is going to be recorded, and I will post it in the CTL for your reference for should you want to look back to it, or maybe you missed us. So, but otherwise, I'd like to thank you all for coming today, and I hope you have a great rest of your day.
Thank you for excellent questions and participating.
Absolutely. Thank you, Dr. Smock.
Thanks.